Hello everyone. Let's talk about some of the Saudi Council Prometric exam questions. A 1-year-old girl was admitted to pediatric medical unit with significant weight loss, diminished mid-arm circumference, diarrhea, and red hair. Which of the following type of malnutrition do the nurse suspect? The options: marasmus, spitting up, kwashiorkor, and rickets. So correct answer is kwashiorkor. So diminished mid-arm circumference, diarrhea, and red hair is kwashiorkor. The nurse is assessing an infant with pyloric stenosis. Which of the following is likely to know? Diarrhea, projectile vomiting, swallowing difficulties, and current jelly-like stool. So pyloric stenosis. So the symptom is projectile vomiting. 33-month-old infant is admitted to the emergency department with fractured arm. The mother indicated that while the child was crawling, fell down stairs and broke his arm. Which of the following observation would lead the nurse to suspect that this is a victim of abuse? Age inappropriate injury, pattern and shape of the injury, child is appearing malnourished, and improper explanation of the cause of injury. So here 33-month-old. So he is already 2.5 years, right? So he was crawling. This is what the mother says. So 2.5-year-old will be running, playing already, right? So why the nurse should suspect a victim of abuse? Because it's an age inappropriate injury. A community health nurse is working with the family in their home. The parents complain that their 8-year-old son is wild and that he never listens to them. They become upset at his antics to gain attention from the nurse and send him out of the room. Which of the following response from the nurse is the most appropriate? That was the right thing. It teaches him who is in charge. Don't worry, he's a boy and with time he will grow out of this. Let's talk about how we can teach your child the right behavior and your expectations of him. You are only reinforcing his behavior when you do that. Try putting him in time out instead. So which is the correct option? Let's talk about how we can teach your child the right behavior and your expectation of him. 11-year-old child is admitted to the pediatric ward with acute lymphocytic anemia and has had a joint pain for several weeks. Physical findings include widespread ecchymosis, generalized lymphadenopathy, hepatosplenomegaly, and pallor. Lab work shows a low hemoglobin level, RBC count, low WBC count, low hematocrit, and low platelets. Which high risk is expected? Infection, fractures, dehydration, and hepatitis. So the correct answer is hepatitis. Why? He had generalized lymphadenopathy and he has hepatosplenomegaly and pallor. That is the main thing that we can suspect hepatitis. Mother brought to her 6-month-old healthy infant to the well baby clinic. Which immunization should the nurse anticipate to administer as per World Health Organization recommendation? So 6-month-old baby is DPT, diphtheria, tetanus, and pertussis. What are the following diseases are prevented by MMR vaccine? MMR is measles, mumps, rubella. That is mumps, measles, and rubella is the another name of rubella is German measles. A nurse in the neonatal intensive care unit is caring for a premature newborn, is diagnosed with respiratory distress syndrome, and the doctor ordered administering surfactant. Surfactant should be given by which of the following routes? Surfactant for a respiratory distress syndrome, it should be given through endotracheal, yeah, remember. Thank you for listening. We will see you in the next topic.